I'd like to introduce Dr. Tarun Sani, where he can address, because in our conference we had professionals from varied field, may it be from criminal justice system, may it be from judiciary, academician. The only professional that we wanted to bring forward who can express how a medical profession can take it forward, what are the challenges and resilience by medical professionals, healthcare workers. So I believe Dr. Tarun Sani is one of the best person to come out and speak about it. And being part of the JGU Medical Board, he would also be able to guide us better in terms of the challenges and resilience of healthcare workers. Over to you, Dr. Tarun Sani.
Good afternoon, ladies and gentlemen. Dr. Sani has something to say. Sir, please go ahead.
I said, although we share the same surname, and although we are not related by blood, but he is more than a brother to me. He has worked. Why we requested him, because there were not many questions which we would like to end to understand. Especially, I'm glad that Kamala has raised a few very pertinent questions regarding about pandemic, because the entire conference was on pandemic. We thought we should get a top expert in this field. So we are ready to listen to you, sir.
Thank you very much. Vijay, can you load my presentation, please?
Yes, sir.
Dr. Sani, Professor Rajkumar, thank you ever so much for giving me such a great opportunity to address a global platform and a large number of very professionals. And as I could see over the last 2 days, I've been logging in and out. There is so much energy in the conference that I really feel privileged that I'm getting an opportunity to also, be on the same platform and share some of my thoughts. I know we've all been facing a challenging time, and the healthcare workers, not only doctors, everybody in the chain is really under a lot of stress. Physical, mental, emotional, social, you name it, all kinds of stresses are being experienced by all of us. Can I go to the next slide, please? So just to place things in context, healthcare workers represent less than 3% of the population in most countries, and less than 2% in countries like India, where we consider ourselves as low and middle income countries. Around 14% of COVID-19 cases reported to WHO are among healthcare workers. So we have a small population, but the incidence of COVID has been very high among health workers. And in some countries, the proportion can be as high as 35%. Lack of PPE, personal protective equipment, exposure to infected patients, work overload, poor infection control and knowledge, and pre-existing medical conditions are factors which have been identified. Health workers face an unprecedented occupational risk of morbidity and mortality. And thousands of health workers have been infected with COVID-19, and a lot of them have actually lost their lives in this entire activity. Next, please. The pandemic has also exposed the face of society which was never seen before. Doctors and healthcare workers who were traditionally worshipped as saviors and who were, said you are like God, are now having to deal not only with the professional challenges, but also to the changed behavior which society has towards them, and calling them as victims, because we go into our homes, we go into our residential societies, we go into our places, and we are being blamed that you are the ones who are carrying these disease from the hospital into the society. The challenge, however, has brought a resilience among the healthcare team to selflessly continue to deliver and perform duties much beyond their mandate. Nobody mandated 8-12 hours of duty with the mask, with PPE, some of us even wearing Pampers because there's no time to take off your PPE suits and go even to the toilet. And I will take you through not only the generic part of it, but some of the personal experiences which we've been facing over the last few months. Next slide, please. So this slide will just summarize some of the challenges which are being faced. Phenomena of percenteism. This, I think, is not only in the healthcare sector, it's in every other, service industry where people are overworking, making sure they're physically present because they don't want to lose their job. And a lot of them have lost their jobs. Private healthcare has kind of collapsed, especially at the small or medium-sized nursing homes. There is hardly any work. People are not, Uh, a doctor with some standing can probably sustain through this, but a healthcare worker like a small porter or a cleaning boy is finding it impossible. I mean, for him, that 10, 15, 18,000 rupees a month, which he used to take, was actually his entire life's or the entire family's salvation. Sorry, behind. You'll take one slide back. Some of the other areas which are really to be considered is this whole thing of the knowledge conundrum, and this is being faced even now. Every day there is a new thought process coming in. Should you be on HCQS? Should you not be on HCQS? Should you take ivermectin? Today's headline, Supreme Court says remdesivir and favipiravir, which are two antiviral drugs, have no use in the entire disease. So we as professionals and doctors and healthcare workers, we are having to face this every day. What knowledge is available? What do we, what do we implement? And what do we tell our patients? We have to bring in the faith saying that we understand the disease, but we are still facing a lot of confusion. And it is not because we are confused, but the knowledge is an ongoing process. What we knew in February was absolutely redundant. What we know in October, we feel that we are well informed, but I'm sure by the time we reach January, we will find that there is a vaccine and there are other perspectives to the disease which we don't know. Next. Nobody ever thinks about a doctor actually being the patient. Through July, I was a patient. We had no clue what this disease was. It's a lonely disease in any case, because you're locked in for 15 days, 17 days. You can't meet your family. You can only speak through video phone calls. And as a doctor, to experience the illness, knowing that we really don't know what we're doing, we do the best, which knowledge is available to us. We do it with the best of intent, but you discover that you have a diagnosis. That's easy. I've got COVID-19. Now what? What treatment should I take? Who is the doctor who will treat me? And is this drug good or is that drug better? Should I be on steroids? Should I not be on steroids? And then the panic comes in, because you feel, that you are 95% of the population where nothing will happen to you. But when you realize that you may be in the 5%, and out of the 5%, there is still 1.5% in India who could lose their lives. So there is a panic. And based on the panic, you again revise your strategy. Towards the 15th day of the illness, I actually got admitted because some of my blood reports were totally haywire. Though I was clinically fine, I didn't have any breathing problem. I was taking a walk. I was walking 5,000 steps, on my terrace, away from everybody. But the disease, when it affects you as a doctor who's supposed to have all the answers, that is a different kind of panic which sets into you. And these are the stresses which people and society are not easily exposed to. Next, please. This is actually my own disease profile. As you can see, 18 days have gone through. And even at the 18th day, I'm still not comfortable. And if you look at all the colored boxes at the bottom, those are all the drugs and all the tests which I've undergone. And I prepared this slide to share on a clinical platform with some of my clinical colleagues. So 18 days down the line, you're still not recovered and you're still suffering from the disease. And then you read about this new word, which all of you would have heard and can Google it. It's called the long COVID. You could be months and months together to complete recovery. You may not actually have all your faculties back. You might be confused in your head. Your heart may be, having myocarditis. Your lungs may never behave the way they used to be. And you as a doctor will understand the worst. You expect and hope for the best, but you understand that, hope is not the only thing which is going to get you through this. So suffering from the disease in presence of a pandemic with limited knowledge and resources is an extremely stressful period. If patients are stressed, you can imagine doctors and healthcare workers who are being exposed to the disease and are falling sick every day. Next slide. Social and family impacts. You finish duty in the COVID ward. Should you go back home or not? You have parents, you have elderly parents in their 70s and their 80s. We as healthcare workers is a humanitarian profession. We came into it, and we were fully accepted the risks which are part of it. But risk to your own personal health is in one side, but risk to the people who are known to you, your relatives, your parents, your children, that is a different kind of a decision. Every day you have to take a decision. Should I go home or not? Should I continue to stay in the hospital? And then the government and society is not helpful in any manner. And as you can see, this is, and you might have seen these posters or these headings in a lot of newspapers. I mean, is India fighting COVID-19 or is it fighting its own doctors? Delhi government doctors have not been paid for 6 months in a row. There are other state authorities where the doctors have not been paid. Social healthcare workers have not been paid. I mean, how can you expect them to perform under such trying circumstances and not even have enough money to be able to look after their parents and their family? Next slide. Caring for COVID patients is, again, it's a faceless existence. You walk in, that's me in a PPE kit on the left side of the screen. And can you recognize me? I mean, I go and see a patient, I deal with him every day. We do 5 days duty in rotation once in a month. The patient doesn't know me. I don't see your face. He doesn't see your face. And that's the kind of disease we're doing. It's not only lonely for the patients, it's also lonely for the doctors and for the healthcare workers who have to be in these gowns for hours and hours together, sometimes not relieved on time, sometimes having to service a critical patient, and we have no identity. We are all overworked. The only thing saving us is teamwork and our commitment to make sure that we deliver what we have been set out and trained to do. Next. So we are all going to get used to this new normal. Medical practice would have changed. We'll be doing webinars, we'll be doing teleconsultations. I look forward to meeting Dr. Sanjeev Sani soon, but I'm not sure when. He'll probably be on a screen for a long, long time to come. But we do continue to be a social support. You get 100 calls every day from different people in different facets. Nobody has ever asked me, doctor, how are you feeling? Is everybody in your house well? Is your mother doing fine? Are your children okay? But you're the social support, you're the pillar. So I'm the pillar, I'm holding support. But there is really, at times you think there is nobody to support us. The community is anxious and so are we. It's not only your anxiety, we are also equally anxious. And if you look about people, having lost jobs, all private healthcare revenues have come down. All our salaries have come down. All our earnings have come down. So we are part of the same anxiety which society is facing. Plus, we have the anxiety of having to deal with a disease where we are learning newer and newer things every day. Next slide. So what does the future hold for us? I think the future is within us. Don't let the behavior of others destroy your inner peace. You have to be at peace with yourself. You have to be at peace with the disease. You have to be at peace with the social area where you live in, your financial resources, your personal resources. And that is really what is going to make you go through this pandemic. Don't let the behaviors of others ever destroy your inner peace. Next slide. In conclusion, healthcare workers are a large and diverse force, some skilled, some unskilled, some visible, some invisible. But each member is an important part of the service chain. The entire team has been working selflessly, placing themselves at risk to perform their duty and service to society. Long duty hours in restrictive PPE clothing, tight face masks leaves one in complete physical exhaustion. There is loneliness, there is emotional and mental trauma which is being faced on a day-to-day basis. The Indian healthcare workers are at a tremendous stress, fear, and helplessness while dealing with this COVID-19 situation. And society needs to recognize their sacrifice and support them equally at this challenging time. Next. The final slide, stay safe, stay masked, stay at a distance, and please stay with the healthcare workforce who are associated with you. What would happen if there was no one there to care for you? Think about it. That's the final words of the World Health Organization. I wish you all safe lives ahead. Be careful with what you're doing, and we hope to see you all face to face, hopefully in the year 2021 once the vaccine is out. Thank you very much. All the best.
Thank you very much, Dr. Tarun Sani. I believe that cannot be a better end to our conference, where you have highlighted that where the health workers who are doing the best, we need to take care of them, we need to understand them, and we need to understand how they are going through. So I believe that is the best valedictory address that could has received for this particular conference. Thank you very much, Dr. Tarun Sani.